One question: if you could go back in time, what's the one thing you did wrong in dealing with rheumatoid arthritis or any inflammatory joint disease that, even if unintentionally, may have delayed or worsened your condition? Hold on, don't answer. I'll go first. Today, I will share with you the top 10 mistakes I've seen patients make, mistakes they later regretted deeply. You might hear one that sounds familiar, one that helps you avoid the same path. And at the end of the video, I'll ask you for something, and we'll agree on a simple action we can do together, something that might help hundreds and hundreds of other patients with RA. This video is for everyone who wants to learn from others' experience and for anyone who wants to help others by sharing their own experience. I'm Dr. Hatem Eleishi, Professor of Rheumatology at Cairo University in Egypt, and I also provide online consultations for patients with arthritis. And this is my channel on YouTube dedicated to different types of arthritis. Let's get started. Mistake number one: delaying the visit to a rheumatologist. Some patients live with pain and stiffness of the joints for many months without seeing a specialist. Even if you saw doctors from other specialties first, in today's world, it's much easier to know which specialty to turn to. Many of my patients say, I just Googled my symptoms and your videos or the word rheumatology came up. Mistake number two: insisting on refusing medications. Some patients still resist the idea of chemical treatment, medications I mean, and try to bargain with the fact that RA must be treated with real medications. And let's be clear, the more aggressive the disease, the more aggressive the treatment needs to be. Natural remedies are so popular, but there's not a single solid scientific study that proves that they are as effective or even a substitute for medical treatment, for medications. I remember one classy lady who told me after a year of trying, "You were right, Dr. Hatem, the treatment is chemistry, just like you said. And if a better alternative ever exists, I'll be the first one to tell you. I'm on your side." Remember that. Mistake number three: underdosing medications. You've been diagnosed, you were prescribed treatment, but you take less than what your doctor recommended, hoping to avoid side effects. Let me be very clear. If your doctor prescribed a specific dose, it's because that dose has been tested and proven to be both therapeutic and safe. Taking less is often a waste of time and won't necessarily protect you from side effects. In that case, you might be drinking medicine with zero benefit. Mistake number four: stopping treatment when you feel better. Whether it's because you dislike the idea of being on medications or you think the disease is gone, the reality is this: symptoms not uncommonly come back, and often worse. And with each relapse caused by stopping medications, the immune system gets more irritated. The next flare might require stronger drugs, higher doses, and more expensive treatment. Mistake number five: experiencing a side effect and turning into a medical influencer. Just because a medication didn't suit you doesn't mean it will not help others. Going on social media and telling others to stop a medication can actually hurt people. What works or does not work for you does not mean that it will act the same way in the bodies of other patients. Mind your own business and leave other patients to be managed correctly by their doctors. Mistake number six: taking medications but ignoring all other medical advice. For example, still overworking your joints, still ignoring lifestyle changes, still dismissing dietary or mental health advice. Sometimes disease activity is driven more by stress and overexertion than by biology alone. When your doctor gives you advice, it's not optional. It's part of the treatment plan. Mistake number seven: delaying follow-up after new symptoms appear. New or worsening symptoms could mean the disease is evolving or becoming more severe. Delaying your next visit might give the disease time to do more damage. Damage that could have been controlled and managed with milder treatment if you had come earlier to the doctor. Damage that could have been controlled with milder treatment if you'd come sooner. Mistake number eight: skipping regular checkups. Regular follow-ups are not a luxury or a waste of money. They serve two major purposes. First, to confirm that your disease is under control, and second, to catch side effects early, either through your symptoms or simple lab tests. A small lab change today could save you from a big problem tomorrow, if caught early, of course. Mistake number nine: hiding your pain from your family and loved ones. You didn't want to make them worried. You didn't want them to pity you. But what happened? Now you're carrying all the burden alone, physically and emotionally, while others around you don't know what you're going through. I've seen too many patients break down because they were too strong for too long. Don't do this to yourself. Mistake number 10, realizing all of this and staying silent. If you've recognized one of these mistakes in your journey, don't keep it for yourself. Your story might save someone else from months or years of pain and confusion. So here's your task. Share this video with any patient that you know they need it and will watch it. And now I want to hear from you. Tell us, what advice would you give to others so that they don't fall into the same trap? And here's what we will do. If we receive enough comments, we will create a new video featuring. And if you want to share your experience in audio or video form, send us a voice note or video clip on the WhatsApp number on the screen. We will include them in a special follow-up episode so that your story becomes a part of someone else's healing. We will include them in a special follow-up episode so that your story becomes part of someone else's healing. I'm excited to read your comments, and I truly believe this video, with your help, can lead us to something even bigger, a community-driven project that helps not just 1,000 but 100,000 patients. Let's do it together.